South Africa's health products regulator on Monday said it would not approve Russia's Sputnik V COVID-19 vaccine due to concerns it could increase the risk of HIV infection among men. We get you more details on this. We're joined by Dr. Boitumelo Semete-Makokotlela, Sahpra CEO. Thank you very much, Dr. Makokotlela, for joining us this afternoon. Let's start with whether any new data has been presented to you on this case.
Thank you for having us to provide clarity to the listeners. So as we said today, we don't have any new data of the safety of this specific vector in the context of a high HIV incidence and prevalence. So we are anticipating that studies would be ongoing. We do have some studies in South Africa, and so as we get this data, we will review it.
And there had been indications that you would not be approving it due to safety concerns on the AD5 component of the vaccine among populations at risk for HIV infection. Can you give us more detail on this?
Sure. So the Gamaleya Institute has two vaccines for COVID. It is the Sputnik V, which has the At25 and the At5. And there's also the Sputnik Light, which only has the At26. So these are adenovirus vectors that are used to deliver the antigen of the vaccine. And so in this case, what was submitted to Sahpra was the Sputnik V, which has both these components. And really the concern we have is around the At5. And this is based on clinical trial data from specifically two trials that took place in 2007. And we don't have any more recent information that demonstrates the safety of this vaccine, but also if there has been any reduction in this risk of having high HIV infectivity in the case where it is utilized.
Are you open to conversation, especially with those applying for the use of Sputnik? Should they present more credible data to you to have that conversation with regards to its use?
Oh, certainly. We remain to be open to that. I mean, and, even in our engagements with them, they've got two types of applications. They had an application for an emergency use and an application for what we call a rolling review. So we've kept the rolling review application open and have indicated that as data becomes available to them, they must provide us with it, and we will then consider the data. And so we really are looking forward to any data being provided to us around this vector.
Ma'am, if you could just remind us of the vaccines that are currently in circulation in the country.
Sure. So as Sahpra, we've authorized the Pfizer vaccine, which utilizes the mRNA platform. We also have the J&J vaccine, which similarly uses the adenovirus vector, but it's a different adenovirus, it's adenovirus 26. And then we also then have the Sinovac vaccine, also a different platform. It is the inactivated viruses that they utilize. And so those are the three that have been authorized. We did authorize AstraZeneca earlier in the year, but that authorization has subsequently lapsed as it was a 6-month authorization.
Thank you very much, ma'am, for your time this afternoon. Dr. Boitumelo Semete-Makokotlela, she's the CEO of Sahpra.